the greatest unmet need in basal cell carcinomas is actually not the large number of basal cell carcinomas we have per year, 2 million around the world, and most of these basal cell carcinomas are easy to treat by surgical excision, by Mohs surgery, or other standard techniques, and the cure rate is quite high, 95%, but if you have in mind this 2 million new cases per year, it's still a significant number of cases, around 100,000, which cause problems in terms of relapse, difficult locations, late detection, ulceration, and, for example, infiltration into underlying structures, and this is the real problem. I think what also is of interest in this context is that we have learned quite a lot about basal cell carcinomas over the last years. The biology is better understood, and we know that Hedgehog signaling pathway is playing a critical role in developing basal cell carcinomas, and possibly interfering with these pathway is giving us also new options.
There is no standard treatment for these tumors, which are very aggressive tumors, and the sonic hedgehog pathway, the inhibitors of the sonic hedgehog pathway are bringing a completely new strategy for the treatment of such tumors. So far, these tumors were really putting the patient at risk of aggressive and eventually of death of the patient. And the only way we could treat them was only either by radiotherapy, but most often this kind of treatment was not possible because of the size of the tumor, because of the location of the tumor, and also because of previous radiotherapy of the tumor, which does not allow to use radiotherapy again. The other option for this tumor was also chemotherapy, but chemotherapy for this tumor is not often used. It's using drugs like cisplatin or doxorubicin, which is very toxic and not easy to use in elderly patients, which are the most frequent patients suffering from this type of tumor. So the sonic hedgehog inhibitors are really bringing a completely new strategy for these type of patients, as it is really targeting the pathway which is involved in this tumor and allowing to take a drug, an oral drug, which is easy to take and with side effects which have nothing in common with previous treatment.
So the basal cell carcinoma, as we know, is the most common human malignancy. And vast majority of cases are treated by surgical excision very successfully. However, the disease can sometimes progress to locally advanced or even metastatic disease. These patients historically have faced very few effective treatment options. Most of the treatments that have been used are anecdotal at best. The understanding of the role of Hedgehog signaling pathway in the development of basal cell carcinoma has played really a crucial role in sparking the interest and activities around development of Hedgehog pathway inhibitors. The inhibition of Hedgehog pathway has been now shown both in phase 1 clinical trials as well as phase 2 clinical trials, leading to FDA approval of the first drug in this field, to be very effective treatment for patients that do not respond to classical treatments. The need is not only in patients with locally advanced or metastatic basal cell carcinoma, but also those that may be at higher risk for development of numerous basal cell carcinomas, such as patients with Gorlin syndrome or patients with other genetic syndromes predisposing to this disease.